Begin by inspecting the head position and facial features.
Okay.
The patient's head should be held upright and still. Check the shape and symmetry of the eyelids, eyebrows, palpebral fissures, nasolabial folds, and mouth at rest, and with movement and expression. These facial features may be
Please smile.
slightly asymmetrical,
Good.
but should have
Wrinkle
no
your
edema,
forehead.
coarsening of
And now
features,
show me your teeth.
lack of expression, or other unusual changes in appearance.
Okay, if you could look straight ahead, I'm going to observe your face.
In an older patient, the eyelids may look wrinkled and hang loosely, and soft bulges may appear under the eyes. Next, inspect the patient's skull for size, shape, and symmetry.
I'm going to be touching your hair and scalp.
Also
Please let me
examine
know
the
if you feel
scalp,
any tenderness
parting
or
the hair and working systematically from the frontal area to the occipital area. You should see no lesions, scaling, or evidence of parasites. Next, palpate the skull from front to back, using gentle
ever had a
rotary
head injury?
movements. The skull should feel symmetric and smooth, with no tenderness, swelling, or depressions, and the scalp should move freely over it. Also, palpate the patient's hair. Its color, texture, and distribution should be appropriate for the patient's age, gender, and ethnic background. In men, hair loss may occur at the temples or crown of the head with age.
And now I'm going to
Then palpate the temporal arteries, which should have no thickening, hardness, or tenderness.
I'm going to listen to your arteries too.
If you suspect a vascular anomaly in the brain, use the bell of your stethoscope to auscultate the temporal area. You should hear no bruise on either side. Slide your fingers down to the temporomandibular joint space in front of the tragus.
Please.
As the patient opens his mouth,
And now close.
gently palpate the joint space. The joint should move smoothly, without limitation,
And again.
tenderness, pain, crepitus,
And
locking, or popping.
Next, I'm going to check your salivary glands.
To finish examining the patient's head, inspect and palpate the salivary glands. They should be symmetrical, but not enlarged or tender. Next, inspect the
gonna take a
neck
look
in
at your
3
neck.
positions.
Look straight ahead.
In each position, you should see bilateral symmetry of the sternocleidomastoid muscle, trapezius muscle, anterior triangle, and posterior triangle.
Now tip your head back a little.
The trachea should be midline, and there should be no fullness at the base of the neck.
And now swallow for me.
You should see no masses, jugular vein distension, carotid artery prominence, webbing,
And again.
excessive skin folds, or unusual shortness.
And now put your chin to your chest.
Now evaluate the range of
Lean
motion
your head
by
back.
asking the patient to flex, extend,
And straighten
rotate,
up.
and laterally
And now
bend
turn
his
your
neck.
head to the left.
The patient should be able to move with no pain, limitation, or joint instability.
Back to center. And now lean your head to your left shoulder and to your right shoulder. And now I need to
Before
feel
palpating the neck, consider the location of its structures, including the hyoid bone, thyroid cartilage, cricoid cartilage, thyroid gland, and trachea. Then feel for the hyoid bone and the thyroid and cricoid cartilages.
And now swallow.
They should be smooth and non-tender, and should
And
move
again.
under your fingers when the patient swallows. Also, palpate the rings of the trachea, which should be distinct and non-tender. Then check the trachea's position by placing your thumbs on each side of it. The space between it and the sternocleidomastoid muscles should be equal on both sides, indicating a midline trachea. Next, put your index finger and thumb on each side of the trachea below the thyroid isthmus. You should feel no tracheal tug or movement in time with the pulse.
So now I need you to take a few sips of water so I can examine your thyroid. So hold on to this until I need you to drink it. And now I'd like you to tip your head back a little.
Inspect the thyroid gland with the
And now
neck
take a
gently
sip.
extended.
And lean your head back and swallow.
The thyroid should not be visible. An enlarged gland may only be visible from the side. Next, palpate the thyroid from the front or behind to assess its size, shape, configuration, consistency, and tenderness, and to detect any nodules. To identify the thyroid isthmus, place your thumb over the trachea about 3 centimeters below the thyroid cartilage. The thyroid isthmus should move under your thumb when the patient swallows.
Take another sip and hold it, please.
To palpate the left lobe, gently push the trachea to the left with your left thumb. Then place the first 3 fingers of your right hand in the thyroid bed, medial to the left sternocleidomastoid muscle. As the patient
And
swallows,
swallow, please.
you should feel the gland move beneath your fingers.
And now take another sip of water and hold it. Check the other side.
To assess the right lobe, reverse your hand positions. If palpable, the thyroid gland should be small, about 4 centimeters wide, with the right lobe slightly larger than the left, and it should feel smooth, firm, pliable, non-tender, and free of nodules.
Okay, I'm going to examine your neck now.
Okay, fine.
In an older adult, the thyroid gland may be fibrotic and may feel more nodular or irregular during palpation. As an alternative, you may palpate the thyroid gland from behind. To do this, place 2 fingers of each hand on the sides of the trachea, just beneath the cricoid cartilage.
Take another sip and hold it.
Have the patient swallow as you feel for the isthmus to move.
Swallow.
Next, displace the trachea to the left and place the first 3 fingers of your left hand medial to the left sternocleidomastoid.
And swallow.
As the patient swallows, palpate the left lobe. Then reverse your hand positions and palpate the right lobe as the patient swallows.
And swallow.
If the thyroid gland feels enlarged, use the bell of your stethoscope to auscultate for bruits, which should not be present in an adult. In a child under age 5, however, bruits normally may occur. You can examine the entire lymphatic system as a whole, or in regions, while assessing other body systems.
Now I'm
Before
gonna check
examining the
lymph nodes
lymphatics
in
of
your
the head and neck, however,
Just
recall the
relax and
location
face
of
me.
the superficial lymph nodes. In the head, these nodes include the occipital, postauricular, preauricular, parotid, retropharyngeal, submandibular, and submental nodes. In the neck, superficial nodes include the anterior cervical, posterior cervical, and supraclavicular nodes. Next, inspect these areas, which should have no obvious lymph nodes, edema, erythema, red streaks, or lesions.
Now I'm going to press lightly on a few places in your head and neck.
Now use the pads of your 3 middle
Lean your
fingers to
head forward
palpate
and
these
relax the
areas.
muscles in your neck. It'll make it
Plan
easier
to move the
feel
skin over the lymph nodes, pressing lightly at first and gradually increasing the pressure. For the head, follow this sequence and palpate the occipital nodes at the base of the skull, postauricular nodes over the mastoid process, preauricular nodes in front of the ear, parotid and retropharyngeal nodes at the angle of the mandible, submandibular nodes between the angle and tip of the mandible, and submental nodes behind the tip of the mandible. For the neck, follow this sequence and palpate the anterior cervical nodes at the sternocleidomastoid muscle. Posterior cervical nodes along the anterior border of the trapezius muscle. Posterior cervical nodes deep to the sternocleidomastoid muscle. And the supraclavicular nodes, pressing deeply in the angle formed by the clavicle and sternocleidomastoid muscle. In healthy adult patients, lymph nodes usually are not palpable. However, you may detect small, movable, discrete nodes. If you find enlarged lymph nodes, characterize their location, size in centimeters, shape, consistency, tenderness, discreteness, and movability or fixation to surrounding tissue. But remember that a young child may have small, firm, discrete, and movable nodes as a normal finding, especially in the occipital, postauricular, and cervical chains. To continue, examine the superficial lymph nodes in the rest of the body, visualizing their location before you begin. These nodes include the epitrochlear, axillary, superficial superior inguinal, and superficial inferior inguinal nodes. To palpate the epitrochlear nodes, support the patient's arm with one hand and use your other hand to press in the depression above and posterior to the medial condyle of the humerus.
Will you lift your arm so I can continue to check your lymph nodes?
To assess the axillary nodes, support the patient's forearm with your opposite arm. Then let your fingers roll over the tissue in the apex, medial and lateral aspects of the axilla, anterior and posterior walls of the axilla, and down the arm to the elbow.
Okay.
To examine the inguinal area,
So I can examine
have the patient lie supine and flex his knees slightly. Add a drape and adjust the gown to preserve his modesty. Then palpate the superior inguinal nodes near the surface over the inguinal canals, as well as the inferior inguinal nodes deeper in the groin. As elsewhere in the body, compare bilateral areas and note any lymph node enlargement or other abnormalities.
Here?
No.
Here?
No.
As this video has just shown, you can learn a great deal about the structures of the head, neck, and lymphatic system with a thorough examination. Together, a careful history and well-performed physical examination are the essential first steps in meeting the needs of your patients.